Hello, Uta Hagen here of Trans Widow, Uta Hagen YouTube channel and WordPress blog, Uta Hagen Grass Widow .wordpress.com, where people use the contact form to write me a message about their experience of the individuals in their lives who have done some cross-sex ideation, otherwise known as alternative gender identity or whatever. I was showing you my notebook that is titled Reflect, which I used to write my lesson plans in, but I now use it for my notes for this channel. Welcome to new subscribers and thank you, my loyal stalwarts. I think that this was an interesting section of Michael Shellenberger's speech. I have had to stop it and start it many times because he starts speeding up so that he can go through this. And I actually think that there is so much here. I thought it was going to be the last quarter of my analysis of what he says, but I decided that since other specified tic disorder and otherwise known as OSTD and dissociative identity disorder, otherwise known as DID, were referenced by the doctors who are writing each other emails in this WPATH World Professional Association for Transgender Health Association. And Michael Shellenberger is going to be exposing these doctors and so-called therapists and transsexuals, especially men who ideate a female persona, who have a lot of power and money. He's going to expose how their influence has really corrupted the medical profession. And you'll notice in my community notes that this new channel called Dad Saves America has an interview with Dr. Eitan Hayim, who is a whistleblower for the Texas Children's Hospital, I think in Houston, where the gender transition, or whatever you call it, is outlawed for minors in Texas, but the hospital was continuing to do it anyway, secretly. And this doctor is a whistleblower, and it's really worth going to Dad Saves America YouTube channel and if you have to do it in sections, to listen to the whole thing. Because this is finally another doctor saying that the medical profession has really taken a wrong turn with all of this. And yes, these surgeries are dangerous. The hormones are dangerous and for young children. And what men like Nettie, my cross-sex ideating ex-husband, understand intuitively, they understand that there's going to be a trickle up to adults, and there will be some questioning of adults. And I believe that this patient that is being discussed here in this internet forum is probably an adult male, because of this thing about growing this long beard. And I mean, maybe he's only 17 or something, but just listen to this. So one comment that I want to repeat from Shellenberger is, we just see people spitballing. In other words, doctors. people who are trained in mental health and healing people when they have psychiatric illnesses are spitballing. So here's this doctor talking about the patient that's not changing clothes and not showering. So these are the doctor's words. I have a patient that's choosing not to change clothes, has not showered since the follow-up nearly a month ago. She's also failing to shave her face and has a quite lengthy beard. So Uta's note here, this means that is a male. And then this business of HRT, so-called hormone replacement therapy, which was originally coined as an acronym for the time of life when some women take a small dose of estrogen as they're going through menopause to lessen the hot flashes and the difficulties. Fortunately, I didn't have that. Okay, but the doctor continues using female pronouns for this patient with the lengthy beard. This is her first month of HRT. Has anyone else experienced this or have suggestions? So now this doctor is obviously prescribing estrogen to this patient who is a male, a biological male, quickly apparently diagnosed. They're talking about only a month. This is follow-up a month ago. So it doesn't seem like this has been some kind of years and years process. So after this doctor says or have suggestions, Michael Shellenberger takes a moment to say, this is like a chat forum about what to do with people's bodies in their care. I've never seen anything like that. So then the doctor continues. Trauma is common among trans clients. Nevertheless, I was surprised that several of my clients met criteria for dissociative disorder, primarily OSTD. So OSTD is the one I mentioned, other specified tic disorder. People might think I have that as I'm closing my left eye because my right eye is the one that I had the cataract surgery in, but the left eye is going to get fixed in a couple of days. Okay, I was wondering if other people have noticed incidents of OSTD and DID among trans clients. So DID is dissociative identity disorder, which used to be called multiple personality. Okay, so OSTD, a tic disorder, and DID, a dissociative identity disorder, where there has been any difficulty with transitioning medically. It's like, okay, we've got quite a lot going on here. If you've got one or the other of those in addition to ideating the concept that you were supposed to have a different body. And then the doctor continues, especially given that not all the alters have the same gender identity. Okay, so this is so when you have multiple personality disorder, which is now called dissociative identity disorder, there are these different personalities, like I think it was called All About Eve. There's this person and that person that is, in your head and you're talking and differently for these different characters in your head. And I think years ago, at least, they were believing and finding that this came from severe child abuse, where your brain was trying to change yourself so that the abuse would stop. Isn't that interesting? Okay, so but this alters. Alters means the different personalities. Okay, so especially given that not all the alters have the same gender identity. So patients who have a psychiatric illness are coming to these gender doctors, and the gender doctors are making the great leap, like across the Grand Canyon, that if they take opposite sex hormones and get ready to have their body surgically changed and have sex trait modification surgeries, that then they're like my site is going to do, then everything in their head will just get centered and grounded. Like, how does this make any sense? Okay. So then Michael Shellenberger says you could do a whole report on this single thread. What's going on here? And then the doctor continues, and I'm not going to go into that one. That's for next time. The doctor continues. I want to make sure I have the words exactly. I had a patient who became dangerous. So, yeah, we know about the dangerous ones, especially we trans widows. The collection of data of 56 of us that I've gotten, the only data in the world, tells us that out of 56 of us whose husband or partner was demanding that we do kink in bed and that we accept him as one of us, a woman, that then he became violent at some point. And, the strangulation attempts were significant, and Tracy Shannon got thrown down the stairs. I did not experience that, but 20 of us experienced sexual assault by the husband after he's been in his lacy panties for a little while. So, I probably will be off a few days, but maybe even next weekend I might even be able to do something. Remember, get outside, take deep breaths, take a look at my wellness movements videos. I'm going to do all of that now. Thank you.